All right, get ready, because today we're going to take a deep dive.
Ooh, exciting.
I know, right?
Yeah.
Into the world of frozen shoulder.
Oh.
And you know how we love to kind of take these medical topics that can be,
Complicated.
yes, exactly.
Yeah.
Break them down into something that,
And anybody can understand.
exactly.
Yeah.
So we've got some really interesting info today from Johns Hopkins Medicine.
Excellent source.
Yeah.
Yes.
And also this really helpful pamphlet
Oh, nice.
that I found that just lays it all out in simple terms.
Perfect.
Yeah.
Yeah.
For those of us who don't have a medical degree.
Exactly. We need that plain language sometimes.
Oh, yeah, absolutely.
Yeah.
So,
We're going to decode frozen shoulder for you today.
yeah, so I don't know about you, but I always thought frozen shoulder was like literally your shoulder freezing,
Haha. I know, right?
like in cold weather.
From being out in the cold.
Yeah,
Yeah. It's
Yeah.
a little more to it than that.
it's more nuanced.
It is, yeah.
So,
Think of it this way. Your shoulder joint is like a ball and socket, right?
right.
Smoothly working, gives you that range of motion.
Yeah.
But with frozen shoulder, it's like that ball and socket get all rusty
Oh.
and seize up.
Oh, that sounds painful.
It can be, yeah.
Yeah.
You lose that freedom of movement.
So that smooth swing of your arm just,
It just grinds to a halt.
yeah.
Yeah.
Okay, and this pamphlet was talking about how it happens gradually
Yes.
in 3 stages.
Yeah, so you start with what's called the freezing stage.
Okay.
And that's where you get that pain that starts. And
Okay.
you start to feel that limited movement.
Got it.
Then you move into the frozen stage where
I don't want to
know
see that worse.
stiffness sets in, pain can get worse.
Oh.
And then finally there's the thawing stage.
Oh.
Things start to improve.
So it does get better.
It does, yes.
Okay.
But that thawing, it can take a while.
Oh, I see. So that's the catch.
Yes, exactly.
Oh.
Yeah.
Okay, so this is sounding pretty dreadful so far.
Yeah.
But if it's not about actual, like, cold temperatures,
Right.
then what is going on inside the shoulder?
It's all about inflammation.
Okay.
So you have this capsule surrounding your shoulder joint.
Right.
And when that gets inflamed,
Uh-oh.
you get scarring,
Okay.
which doctors call adhesions.
Adhesions.
So you can kind of think of these adhesions as bands of tissue
Oh,
that form around the joint.
Oh, so they're kind of,
They kind of glue things together.
yeah, like they're restricting the movement.
Exactly, restricting that movement. Yeah, and that's what causes that stiffness and pain.
So the inflammation kind of kicks off this whole chain reaction.
It does.
Yeah, that makes sense.
Yeah.
But is there anything that makes someone more likely to get this in the first place?
Yes, definitely some risk factors.
Like what?
Age is a big one.
Okay.
So people between 40 and 60,
Okay. So middle age?
yeah, they seem to be more susceptible.
Okay, interesting.
And also, if you've had your shoulder immobilized for a while, like maybe from an injury or surgery,
Okay.
that can increase your risk.
Got it.
And here's an interesting one.
Yeah.
Diabetes
Really?
is linked to a higher chance of developing frozen shoulder.
Huh. I never would have thought of that.
Yeah, it's interesting, isn't it?
Yeah, like how are those two things even connected?
That's a great question, and it's something that researchers are still trying to figure out.
Oh.
But one theory is that high blood sugar levels
Okay.
might affect the collagen,
Okay.
which is a key part of that shoulder joint capsule.
Oh, that makes sense.
Yeah,
Okay, so it's a bit of a medical mystery still,
it is a little bit,
but something to be aware of.
definitely.
Yeah, okay, so say someone is experiencing this shoulder pain and stiffness.
Right?
How do doctors know it's actually frozen shoulder?
It's a good question because there are other things that can cause similar symptoms.
Oh, what?
So careful diagnosis is key.
Okay, how do they do that?
Well, usually the doctor will start with a physical exam. So they'll check your range of motion, see where that pain is.
Got it.
They might also take some x-rays
Oh, right.
to rule out other conditions.
So like what?
Things like arthritis or calcium deposits.
Okay, so they're ruling out other culprits.
Exactly.
Make sure they're going after the right thing.
Yes, very important.
Yeah, that makes sense.
Yeah.
So once they've kind of confirmed that, yeah, it's definitely frozen shoulder,
Right.
what's next?
Well, then it's all about figuring out the best way to treat it.
Okay, and the good news is
Yeah.
that there are treatments that can help you regain that mobility.
Absolutely, yes.
That's good to hear.
Yeah.
So walk us through the options.
Sure.
What are the treatments?
So I'm assuming you're thinking physical therapy.
Yeah. Is that a big part of it?
Absolutely. Often the first line of defense.
Okay.
So the main goals there,
Yeah.
increase your range of motion
Uh-huh.
and decrease pain.
Okay. Sounds good.
Yeah, so therapists will use all sorts of different techniques to gently stretch that shoulder capsule
Oh, okay.
and break up those adhesions.
Okay.
And they'll teach you specific exercises you can do at home.
So you're not just going to therapy. You're doing
Yeah.
stuff at home, too.
Exactly. Yeah, to keep that progress going.
Got it.
And sometimes they even have you use different tools,
What?
like a wand or an overhead pulley system.
Okay, so I'm picturing like I'm
Oh,
conducting my shoulder muscles with a wand.
that's a great image.
Yeah, it sounds kind of fun.
It can be.
But it also sounds like it takes a lot of work.
It does. Yeah, it takes dedication.
But, I guess if you could actively work towards healing your shoulder,
Yes,
that's a good thing.
absolutely.
Yeah.
Yeah, and along with those exercises,
Okay.
doctors often recommend over-the-counter anti-inflammatory medications
Right.
like aspirin or ibuprofen
Okay.
to help with that pain and inflammation.
Right, to manage those symptoms. Yeah.
Exactly.
Okay.
And sometimes they might prescribe stronger pain relievers or even consider corticosteroid injections
Oh, right.
directly into the shoulder.
So that would be like more targeted relief.
Exactly.
Okay, so it sounds like a multi-pronged approach
It is, yeah.
to tackle the pain and the stiffness from different angles.
Exactly.
But I imagine the big question everyone has
Oh, yeah.
is how long does it take to actually recover from this?
Right.
Because we talked about how it's a process, it's gradual.
It is,
Yeah.
but yeah, that's the million-dollar question.
Yeah.
And unfortunately, there's no one-size-fits-all answer.
Oh,
Because recovery time really depends on the individual and how severe their condition is.
so there's no magic bullet?
Not really, no.
Aren't.
But consistent physical therapy
Huh?
and diligently doing those home exercises.
So it's all about that consistency.
It is, yeah.
Okay.
That's key.
Got it.
Yeah. So some people might see significant improvement in 6 to 9 months,
Okay.
while others might bounce back in just a few months.
Okay.
It really varies.
So it's a journey.
It is, yeah.
And you've got to be patient
Patience is key.
and stay positive.
Absolutely.
Yeah, well, that's some great info.
Thank you.
And you know what? We're going to take a quick break here, but when we come back,
Yes.
we're going to delve deeper into this whole recovery process.
Sounds good.
Yeah, and explore what you can do to prevent this from happening in the first place.
Excellent. I look forward to it.
All right, we'll be right back.
Welcome back.
So before the break, we were talking about that recovery time and how it can be different for everybody.
Right. It really varies.
And I think it's worth pointing out that even though it might take a while,
Yes.
there's still a lot you can do to actively be a part of your healing.
Absolutely.
It's not just like you show up for your physical therapy appointments
Right.
and then that's it.
It's a process.
Yeah. So tell us about those home exercises.
Yeah, those are essential
Okay.
for maintaining that progress you make in therapy
Uh,
and really for preventing that shoulder from stiffening up again. So think about it like going to the gym.
okay.
If you went once and never went back,
Right.
you wouldn't expect to see lasting results.
No.
So it's the same kind of thing
Okay.
with frozen shoulder rehab.
Got it.
You got to be consistent.
So it's about building up that strength, that flexibility,
It is, yeah.
and making it a part of your everyday life.
Exactly.
Okay, but what happens when physical therapy is over?
Right.
How do you know
Well,
when you're like fully recovered?
it's not always a clear-cut finish line.
Oh,
So your physical therapist will work with you
okay.
to gradually decrease those sessions
Okay.
as you regain your strength and mobility.
Got it.
But they'll also give you a set of exercises
Okay.
to keep doing at home.
To maintain that progress.
Exactly.
So it's like this gradual transition.
It is.
You're not just like thrown out into the world.
Right.
They're
Anything
giving you the tools and the knowledge
Yes.
to keep your shoulder healthy.
Exactly.
Okay, so I guess everyone is different,
Oh,
right?
yeah.
Some people might go back to full range of motion,
Yeah.
and others might have some stiffness.
Exactly. Everyone's recovery is different.
Yeah.
But the goal is to get to a point
Yeah,
where you can comfortably do the things you love
right. Without pain.
without pain, without restriction.
Right.
And here's something we came across in that pamphlet.
Yeah.
Apparently internal rotation,
So,
which is that motion of reaching behind your back
right.
that often takes the longest to fully come back.
Oh, I can see why that would be a tricky one.
It is, yeah.
It's just a weird angle.
It is. It requires a lot of flexibility and coordination,
Yeah.
but with patience
Okay.
and consistent effort.
Okay.
Even that can be restored.
Our bodies are amazing.
They are, yeah.
Like they really want to heal.
They do. They have this incredible capacity to adapt and heal.
Yeah, that's encouraging.
It is.
So we've talked about physical therapy. We've talked about home exercises.
Right.
What about the role of the doctor in all this?
Oh, yeah. They're very important. So they're the ones who initially diagnose the condition,
Right.
making sure it's actually frozen shoulder,
And not something else.
not something else exactly.
Yeah.
And then they recommend that course of treatment.
So they might prescribe medications
They might.
for pain and inflammation.
Yes, and they'll stay in close contact
Oh,
with
wow.
the physical therapist
Oh, right.
to monitor your progress.
To make sure things are going in the right direction.
Exactly.
So you've got this whole team of experts.
You do. It's a team effort.
Yeah, that's reassuring.
It is. You're not alone in this.
And speaking of teams, we should talk about prevention, right?
Oh, absolutely.
What can people do to lower their risk of getting this in the first place?
Because an ounce of prevention is worth a pound of cure, right?
Exactly.
So one of the best things you can do,
Good.
keep your shoulder moving.
Okay, so like exercise.
Yeah, regular exercise.
Right.
That involves a full range of motion.
So what kind of exercises?
Think swimming, yoga, or even just some simple stretches at home.
So just keeping things moving.
Exactly. Keep those joints lubricated, those muscles limber.
Yeah, I like that.
And if you've had a shoulder injury or surgery,
Okay.
make sure you follow your doctor's instructions for rehabilitation.
Right.
Beautiful.
So don't push yourself too hard.
Right, but don't let that shoulder stay immobilized for too long either.
Okay.
You got to find that balance.
Rest and movement.
Exactly.
Okay. And what about underlying health conditions?
Yes. So if you have something like diabetes,
Okay.
managing that effectively
Okay.
can also help reduce your risk.
So taking care of your overall health.
It is. It's like laying a strong foundation for your musculoskeletal system.
That makes sense.
And here's another one.
Okay.
Pay attention to your posture.
Oh, posture. Okay.
Because slouching or hunching your shoulders
Okay.
can put extra strain on those shoulder joints, making them more susceptible to injury and inflammation.
So good posture is not just about looking good.
It's not. No.
It's about protecting your shoulders.
It is.
Okay. Wow. We've covered a lot of ground
We had
in this deep
a
dive.
lot of information.
We've explored what frozen shoulder is, how it's diagnosed, treatments,
The treatments,
the prevention.
the prevention.
It's amazing.
It is. And, even though it can be a frustrating process,
Right.
it can take a while.
Yeah.
It is treatable.
That's the good news.
It is. That's the key takeaway here.
Yeah.
So with patience, perseverance,
Okay.
and the right guidance from those healthcare professionals.
Your team.
Your team. Exactly.
You can regain that mobility
Yes,
and get back to doing the things you love.
absolutely.
That's what it's all about.
It is.
We're back for the final part of our frozen shoulder journey.
And we're going to wrap things up by looking at some of the newer treatments.
Well, cutting edge stuff.
Yeah, cutting edge. You got it.
Okay, so what's out there?
Well, one thing that's showing promise is the use of biologics.
Biologics. What are those?
So they're medications,
Yeah.
but they're derived from living organisms.
Interesting.
And they can help reduce inflammation and promote healing.
Oh, so it's like they're
Yeah.
getting to the root of the problem.
Exactly. They're not just masking symptoms.
Yeah, that's really cool.
Yeah, they're being used for other conditions already, like rheumatoid arthritis.
Okay.
But researchers are now looking at them
Okay.
for frozen shoulder.
So that's great.
Yeah. And another interesting one
Okay.
is platelet-rich plasma therapy.
Platelet rich what?
Plasma.
Plasma. Okay.
PRP, they call it.
PRP. Okay, easier.
Yeah, so basically they take a sample of your blood,
Okay.
concentrate the platelets,
Okay.
and then inject them back into the shoulder.
Wow, so it's like using your body's own healing power.
Exactly.
Yeah.
That's amazing.
Yeah, the platelets are rich in growth factors,
Oh.
which can help repair tissue.
And reduce inflammation.
Exactly.
It's like giving it a boost.
Yeah, it's like a little boost. Yeah, I like that.
And it seems more natural
Yeah, that's
than
right.
some traditional treatments.
Okay, so are these treatments like readily available?
Well, more research is still needed
Oh,
to really understand how effective they are long term.
right, of course.
But they definitely offer hope
Yeah.
for those who haven't had success
Yeah.
with other methods.
That's really exciting.
It is, yeah.
There's always new things on the horizon.
There are always new things coming out.
Yeah, and even with all these new things being developed,
Right.
I think the big takeaway for me
Yeah,
is that mind-body connection.
absolutely. Yeah.
Staying positive, participating in your own recovery.
It makes a world of difference.
It does.
Yeah, it's about trusting that process,
Without-
working with your healthcare team.
Right, your team.
Yeah. And celebrating those little wins.
Even the small step.
Exactly, those small steps forward.
It's a journey.
It is a journey.
And you've got to enjoy the process.
You do, yeah.
And as we wrap up this deep dive,
Yes.
I'm curious,
Yeah.
what advice would you give yourself
Oh.
if you could go back in time
Yeah.
to before you experienced frozen shoulder,
Ooh. That's a good one.
knowing what you know now?
I would tell myself to listen to my body, Really pay attention to those little twinges of pain.
Okay.
Don't ignore them.
Okay, don't just brush them off.
Yeah, and I would say really emphasize that staying active and having good posture.
Preventative measures.
Yes, those preventative things we talked about.
Yeah, those are important.
Very important.
Yeah, and I think I would also tell myself to be patient.
Oh, yeah.
That it takes time.
Patience is key.
It is.
Yeah, trust the process.
Trust the process.
And celebrate every step.
Every step.
Every little victory.
Love it.
Yeah.
Well, on that note, we'll bring this deep dive to a close.
I think that's a great place to end it.
Yeah.
Thanks for joining us.
Yeah, thanks for being here.
Hope you learned a lot about frozen shoulder.
And we hope you feel empowered.
Yes.
To take charge of your own shoulder health.
Absolutely.
And remember, there's always hope.
Yes.
There's always help.
Always.
And there's always something you can do
to
advocate for your well-being.
Couldn't agree more.
So stay curious, stay informed, and keep those shoulders moving.
We'll see you on our next deep dive.